Today I'm going to talk about the procedure called the gluteal lipectomy. We also call it a buttock lift or lower back lipectomy. It's one of the more common procedures I perform in patients who lost a lot of weight. Now, when I say common procedure, it's usually combined with other procedures. It's usually not done on itself. Usually it's a circumferential abdominoplasty or circumferential lipectomy that I do it with. But in this video, we're going to talk about specifically the gluteal lift. After major weight loss, the skin around the lower back of the buttock often does not spring back, so it's a bit loose and what we call ptotic or low lying. Exercise and diet cannot remove the skin, and a gluteal lipectomy removes the excess skin above the buttock to lift up the tissues. It doesn't add volume, and the goal is to elevate the buttock and get rid of the loose skin in that lower abdominal area. The procedure is, now, how does it fit into a lower body lift or belt lipectomy or circumferential abdominoplasty? This procedure is a back component of what's called a belt lipectomy. So some patients are perform it on its own. In others are combined with an abdominoplasty or flank correction as part of a full circumferential lipectomy. Now, some patients prefer a staged approach, meaning that we do the front first. So we'll do whatever we do in the front, so abdominoplasty extended or something like that. And then we usually come back at a later date, usually about 3 months after, to do the back part. And the right plan really depends on your overall health and your body and what your wishes are and all that sort of thing. In the last 5-6 years, I have been doing a bigger and bigger operation and combining a lot more. So usually it's part of the circumferential. Now, not everyone is a good candidate for this. It's really for the patients that have had massive weight loss. And you need to be stable weight. If you are wanting to access Medicare, you need to have functional issues, so rashes, discomfort, pain, that sort of thing from the loose skin. And obviously you need to be a good candidate, have not too much what we call comorbidities like diabetes, smoking, all that stuff. What happens in the consultation with me? All patients need a GP referral first. The first consultation is around 1 hour, and I review your full medical history, and I'll examine your body, we take photos, and I'll go through what your expectations of the result is and why you want this done. We also talk about nutrition generally, because most of the time the patients that are having this are post-weight loss. The second consultation I always tend to do as well, and then we go through the blood results, go through any questions you might have, and some other things as well. All surgery obviously carries risks, and with this procedure, the main ones are wound healing issues, and we deal with wound healing issues quite a bit. The wound healing issues usually in the middle, the natal cleft, very common to get that. Infections, usually they're minor, but they can be deeper. We don't do a lot of undermining or elevate the skin, so we tend not to get infections that are too deep. Now, blood clots, infection, bleeding, scarring, aesthetic problems, all part of this operation, and I have a separate video that we go through these complications with. We'll try to link that to this one as well. Now, I do my operations in Maitland Private Hospital. It's a fully accredited hospital. It's got a 24-hour medical cover as well as an ICU, which has come in handy a lot of times, and that's a really good, especially for my bigger post-weight loss patients that do tend to have much longer operations and do end up with maybe blood pressure issues or some other issues post-op. It's very handy to have that backup in the hospital. What about the results? So the main thing is that we are cutting that skin at the top of the buttock area. That means that we're getting rid of the loose skin, we're lifting the buttock up, and then elevated the buttock. Now, the key thing there is that when you lift up the buttock, you are actually reducing the size of the buttock. So it can look a little bit flatter afterwards than you would like. Okay, because it lifts it, and then you get a little bit of flatter buttock. So you need to, work your gluteal muscles if you want a bit of shape. A lot of times with our post-weight loss patients, they don't have much fat. So things like fat injections in the buttock are not that not that possible in those patients. Things like implants and things for volume is possible, but there's a lot of issues with implants, so there's just a bit of a deficiency there of that area. Make sure you have a referral. We always need a GP referral when you come to see me, and we'll go through the back area for you as well. Now, the other thing I would mention is we're doing the lower back. The back is really adherent. So sometimes it doesn't treat the top part of the back area, and that's more of a back lipectomy, upper back lipectomy, or bra lipectomy. So there are two different operations that can treat the back area in that way. So thank you for watching. See me in the next video, and this has been Dr. Bernard Beldholm.